Now, let's observe the assessment of this face. Zoom in. We notice the presence of nasolabial folds and also the presence of a long lid-cheek junction. Take a look at the position and attachment of the dermis into the deep plane of the parotid fascia. When the patient tilts down, eyes up, we notice that the nasolabial fold is prominent, but because of lack of support of the cheek. So in her case, we need to give support and provide the indirect approach first. Take a look, the area that is empty, and we need to go back to the correction of the cheeks. Observe. So before we proceed with the injection, it's very important to go to the marking. So to mark the indirect approach for the nasolabial fold, it's always important to tilt down the face with eyes up so that we can see efficiently the transition of the lower eyelid and the cheek. Eyes up. After this is the time that we palpate L1. And L2. Never forget that before injecting L3, I have to remember the position of the infraorbital artery. Now, before starting, antisepsis is mandatory. For L1, we have to use Juvederm, close your eyes, Ultra Plus. Retract, pinch, and touch the deep plane. I'm now injecting 0.2 and 0.2 in L2. So now, after injecting L1 and L2, please observe how smaller her cheek looks, because I ended up by lifting to improve the nasolabial fold. I would also like to show you how the nasolabial fold is less evident in the treated site. Also, please observe when the patient smiles. Smile. Take a look. On the treated side, we notice much less nasolabial fold. Relax. Now, I notice that in the area where we have the projection of the infraorbital foramen, there is a slight concavity. So I need to give support to reduce the upper part of the nasolabial folds. But for this indication, I need to proceed with a blunt cannula. Now, to work with cannulas, we need to enter with a needle and with a round movement create support. Okay? Now, very gently injecting in L3. So now, after injecting L1, L2, and L3, we notice an important change into the nasolabial folds. Relax, open your eyes, and take a look when the patient sits up. Smile. Take a look that on the treated side, we don't see anymore the nasolabial fold. So now, after injecting L1, L2, and L3, we notice an important change into the nasolabial folds. Relax, open your eyes, and take a look when the patient sits up. Smile. Take a look that on the treated side, we don't see anymore the nasolabial fold. Okay, let's do the same thing. L1, L2, and L3 we need to inject with a cannula. Close your eyes. Close your eyes. So 0-2 in L1, 0-2 in L2. Now, after injecting L1 and L2, let's observe what happens when she smiles. Smile. We see less, but still relax. I have an empty space at the level of L3. So now we are working with a cannula. Now we proceed with L3. Pinch and slightly with a circle movement, let's inject in L3. Sterile. Get the cotton bud, sterile. Clean. Excellent. Ton bouton. Now I'm injecting Ultra Plus, total of 0.3 in L3. Now, after treating both sides, smile, we see that we still have improvement in the nasolabial fold, but I can inject NL1 to reduce the expansion of the nasal flare. Relax. Now cleaning to inject NL1, the direct approach. I injected 0.2 to reduce the excursion of the nasal flare. Smile. When she smiles, please observe that now the treated side has less widening of the nasal flare. Now let's do the same on the contralateral side. Now, let's review the treatment of this patient. I injected L1, L2 with Juvederm Ultra Plus with needles for deep support. And L3 I injected with a cannula, also with Juvederm Ultra 3, because it was close to the infraorbital foramen. And after, to improve the nasolabial fold directly, I have injected NL1 with Juvederm Ultra Plus, and also to give narrowing of her nasal flare. Immediately after the result, she looks natural, both at rest and also on animation. Smile. After finished all the treatment with Juvederm and Juvederm Ultra Plus, it's time for us to reshape her brow. Now for this, let's think about Botox. Let's go. Can you please frown? Angry? Show me. We notice that she presents very important frowning. And as you may see, I inject very close to the hair. So that's why I need a precise product. Relax. Now, let's go and clean. Cleaning is very important. Proceed with the injections. And be careful. Release your finger so that you protect the deep structures. The lateral must be more superficial, so we penetrate just the tip of the needle, because the fibers of corrugator are more superficially. Very important is no massage. Clean the dots upwards so that there is no risk of compromising any levator.